From my perspective, it's another layer of safety. So we talked about safety a little while ago. It's one more avenue to protect pharmacy and nursing personnel. We've got to think about the current mechanisms that we use to administer medications now evolved out of the 20s and 30s. And so if you think about the vial, a syringe, a needle, okay, this was before really the dawn of modern chemotherapy, which actually came in the 1940s, or 50s. Nobody was thinking about contamination on vials. I mean, even in the 1970s, which is sort of when things started becoming more apparent. It wasn't until the late 70s when the first testing came about that showed that people were being contaminated by hazardous drugs. And they had to figure out where was that contamination occurring. How did it get into the urine of nurses and pharmacists who were handling chemotherapy? We looked at how we administer drugs. So in the 80s and the 90s, we moved a little bit more away from needles to needleless devices, which were great for avoiding needle stick injuries, and pretty much that's mandated now across the US. But as a whole, the needle-free systems were not designed to protect us from chemotherapy exposure. Again, we're still using vials, and the whole system of getting the drug out of the vial, it's been around for decades. And hopefully at some point we'll get to a point where the vials that contain hazardous drugs are actually designed differently than vials for antibiotics or for other medications that are not hazardous. But right now, they're coming across the same as they are for a vial of any other medication. And there's been dozens of studies that have shown wipe testing on the outsides of those vials show contamination on the outside. So if it's already coming from the factory that way, then we've got a problem before it even gets into the shipping and receiving department of the hospital. So I think in the big picture, we need to sort of relook at how we do this. The downside is that tremendous amount of money to retool, reinvest in different types of vials from all the manufacturers who are making vials, supplying them to all the drug companies. I mean, that's a whole different, it'd be like telling the automotive industry that starting in 3 years, we're not using gasoline anymore, we're switching to propane. And imagine the kind of changes that would require.